What if an improperly diagnosed x-ray report led to you having chronic pain and suffering for the rest of your life? This episode, I'm going to show you guys the 7 last x-ray reports that I got, and I'm going to show you how I analyze them and read them, and I'm going to show you why, unfortunately, almost every radiologist don't read x-rays properly. Now, a neuroradiologist will, but I want to show you why the problem is causing patients to suffer even more. So you want to go to an expert who knows how to read these. So let's dive in. Let's take a look at these statistics here. Medical treatment for chronic low back pain costs practice members or patients $9,000 to $19,000 annually a year. I know firsthand when I'm looking at images and x-rays, I want to see that the spine is healthy and normal from all angles and all positions, and that it moves properly through its full ranges of motion like a normal joint should, and it doesn't have any restrictions, because restrictions in movement means restrictions in quality of life. So I'm going to show you exactly how I see that on the x-rays and measure it. That spine is completely straight. There's no curve whatsoever. All they would have to do is measure that, which we did. Here's the film. Only 28 degrees, and the curve starts to go in the wrong direction. What's that going to do to this woman's spine? Well, if we look at the literature, the literature shows that if you lose the lumbar curve and you start to have a lot of compression, that's going to lead to chronic pain and disability. That's exactly what's going on here. So the radiologist read isn't helpful whatsoever, because this patient needs to know that they have no curve in their spine. So that's going to cause a lot of dysfunction and disability as they age. So what do they need to do? They need to fix it. But let's look at some other x-rays to see if this pattern is normal with radiology reads. So this film really hits home for me. This is actually the same patient, and this is the cervical spine. This is the neck view of this patient. This one says loss of normal cervical lordosis. That's not a loss of normal cervical lordosis. That spine should be all the way back here where the neck fold is. What we have here is actually kyphosis. It's the wrong direction. Straight up and down would be right here. This is actually going the wrong direction, and there's actually multiple curves in this spine. No evidence of instability on flexion view or extension views. Now here's the problem. They didn't measure that. I can tell you why. When this spine gets bent forward, let's look at this right here. If we measure this, you're going to see right here, that's 3.4. That's actually unstable. And if they measure this one, that's 3.62 millimeters. So actually these are unstable. These are technically and by definition unstable. Instability is right there what you're looking at. And these weren't measured, but it's also very easy to see that that's very unhealthy. So at least they should say ligament lax in here. But I don't expect to see that from reports.